I'm depressed, I got pain in my chest. We could be lactic acid, but I'm afraid to ask a doctor. Maybe I should die right after. Whoa, 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 whoa. I forgot to mention I got hypertension, and I'll joke that it's cause of my wife. Slow my heart rate down, and I'll take a calcium channel blocker, and I'll sleep through life.
Hello everyone, my name is Alicia. And I'm JJ. And this is a special report from your Group 9 Health Watch. Today we're taking time to talk to you about your health and your blood pressure. With 1 in 3 Americans affected by hypertension, it is important to understand what it is, so that we can make educated decisions based on how to avoid it or maintain it.
Your arteries are elastic vessels that carry oxygenated blood away from your heart to your organs. The pressure exerted against their walls depends on many factors, including peripheral resistance, blood volume, cardiac output, and vascular distensibility. Vascular distensibility is the artery's increase in volume for each millimeter of mercury rise in pressure. In other words, this is the artery's ability to stretch. Veins, which are the vessels that return deoxygenated blood to your heart, are more elastic and have vascular distensibility 8 times higher than the arteries. And up to 60% of the blood is in the veins. When they are constricted, large quantities of blood are transferred to the heart, and as a result, increasing the cardiac output in the arteries. Unfortunately, artery distensibility decreases with age. This dramatically affects blood pressure. Particular diseases associated with higher blood pressure are arteriosclerosis, patent ductal arteriosus, aortic regurgitation, and aortic stenosis.
Stan has more on this subject. Let's hear what he has to say.
Hey, Alicia and JJ. I'm here at the cardiology center where patients are coming for their routine checkups. Payal has agreed to document our trip today. Dr. Joanna Kaczmarczyk, can you tell us what exactly you're reading when you're using the cuff to check blood pressure?
Well, the method I'm using here is called the oscillatory method. It's the most commonly used method for measuring systolic and diastolic pressures. We can use the cuff to measure the pressure in the antecubital artery. Generally, air is pumped into the cuff and released slowly so that we can pay attention to where we can hear the love-dove sounds. We call them porta-cough sounds. The point at which we start hearing them, we record that as the systolic pressure. The point at which we stop hearing them, we call that the diastolic pressure. It may be easier to understand by saying that systolic pressure is the maximum pressure exerted by the blood against the artery walls. It is the result of ventricular systole or contraction. It is normally 122 millimeters of mercury, and diastolic pressure is the lower pressure in the artery. It's a result of ventricular diastole and is usually around 80 millimeters of mercury.
Blood pressure so high, I'm going straight to heaven. 160 over 137, oh no.
And what are we learning from today's patient?
Our patient had a serious case of arteriosclerosis.
Well, what does that mean for her?
It can mean a lot of things. Arteriosclerosis is the thickening of artery walls, but also these degenerative changes wrinkle the vessels and promote accumulation of cholesterol and lipid in the walls of large arteries. If enough builds up, it can lead to thrombus formation. If it's big enough, it can lead to a myocardial infarction, also known as a heart attack.
Wow, this information is alarming. Payal, how do you see this affecting you and your lifestyle?
Well, I definitely see some major lifestyle changes occurring in the near future. It's pretty clear that I need to protect myself from my already broken arteries. I will have to take this seriously and listen to what Dr. K has told me. Daily exercise is necessary for me to keep my blood from pooling. Otherwise, I will have invited blood clots to form. Along with that, I have to focus on eating clean. If I can stay on track, then maybe we can lower the doses of my blood pressure and cholesterol medications.
Definitely. The goal is to keep you healthy, and the medication is only part of the treatment. The outcomes will depend on your commitment to your new healthy lifestyle. Alicia, JJ, back to you.
Thank you, Stan. Let's talk about some of the effects of arteriosclerosis.
It can lead to angina, myocardial infarctions, peripheral vascular disease in the legs, and strokes. It's important to note that dietary changes, including reduced cholesterol intake and regular exercise programs, assist in lowering blood lipid and cholesterol levels and lessen the risk of vascular degeneration and high blood pressure.
Wow, JJ, looks like I'm going to walk home tonight.
Or run.
But it's also important to know that low blood pressure is common and dangerous. Stan, if you're still with us, can you find out some info for the viewers about hypotension?
Hey, Alicia. Yeah, I'm still here. And I have Dr. Goyani here to answer our questions. Hey, Dr. Goyani, very quickly, I'm sorry to bother you, but is there anything that we should know regarding low blood pressure?
Well, low blood pressure that leads to hypertension is also known as shock. It results from decreased circulating blood volume, leading to decreased tissue perfusion and general hypoxia. Pure tissue don't get enough oxygen. That leads to more anaerobic metabolism and increased lactic acid production. CNS and adrenal medulla would most likely try to increase your heart rate and constrict your vessels, and when it will be secreted to increase your blood volume. There are many cases where you may experience shock. For example, pregnancy, severe third-degree burns, improper dosing with blood pressure medication, dehydration, or from many particular disorders such as endocrine or neurological.
Wow, thank you. That was very insightful. Well, Alicia, JJ, back to you.
Thank you, Stan.
Well, that's all for us today. We hope you've learned something and will spend more time taking care of your own body. As far as we know, YOLO, you only live once. So take care of yourself, and we'll see you next time.
We hope you enjoyed our presentation. Our group chose to speak about blood pressure because the issue is particularly important as it directly relates to many other diseases that affect people every day. Nearly 1 in 3 American adults have high blood pressure. 2 in 3 people with diabetes report having high blood pressure or take prescription medications to lower their blood pressure. Chronic levels of stress and cortisol can contribute to decreased blood vessel elasticity over time. Atherosclerosis is present 10 times more often in obese people compared to those who are not obese. But obesity in general will raise your blood pressure. Additional fat tissue in the body needs oxygen and nutrients in order to live, which requires the blood vessels to circulate more blood to the fat tissue. This increases the workload of the heart because it must pump more blood through the additional blood vessels. More circulating blood also means more pressure on the artery walls. Hypertension may lead to angina, heart attack, heart disease, peripheral vascular disease, stroke, eye problems, or even kidney disease. Times are hard and very stressful. With continually rising costs in healthcare, the most effective method of taking care of yourself is in fact taking care of yourself. It may be easy to forget how important exercise really is, but the bottom line is that it's your life and your health. So it's your responsibility to research and adopt healthy lifestyle changes if you're able to do so. And ladies, eating dramatically less is not the answer. Eating better is. Thank you again. We hope you join us for our next presentation.
What a mess, I'm depressed, I got a pain in my chest. We could be lactic acid, but I'm afraid to ask a doctor. Maybe I just die right after. Whoa, 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 whoa. I forgot to mention I got hypertension, and I'll joke that it's cause of my wife. Slow my heart rate down, and I'll take a calcium channel blocker, and I'll sleep through life. Whoa, 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 whoa. I'm a human disaster, can't stop eating fast, but I'm poor, what can I do? Another ball of plaque, a fatal heart attack, my dear wife, I love you. Goodbye.
Get back in here!
Okay, man, we can get it from this side.
Can I just hold on?
Okay. So next one is you fall in. Go like this.
What I need to do is I need to like sit down like this.
That's good, that's good.
Yeah. You know what?
Just like
Just do that. Hold your shoulder. Everybody go over your shoulder. And then you guys kind of go to like me to do it. Like yeah. Well, hold your heart. Hold your heart.
I go dazed and confused.
Can I just push your back?
That'd be fine.
You look.
Push
Your hand. You're making more. Actually, really good. I think I was.
I have to be
Or just feel like.